top of the stomach. And you said it was sharp?
Yeah.
How long would it last when you get these episodes?
A few minutes after.
Minutes, got it. So it starts within minutes and it lasts for several minutes, and then it goes away? Okay. And
as long as I don't eat anything.
As long as you don't eat. So if you eat presumably several times a day, you'll have several of these episodes throughout the day. And if you don't eat at all, you don't get them. Okay. Is there anything else besides eating that seems to set this off? No? Okay. So nothing else besides eating that you're aware of?
Yeah.
No other triggers. What about things that make it better?
Warm running water.
Warm water?
Yeah.
Interesting.
And the ginger tea, she's been able to drink that before.
Does that help? Ginger tea, okay. Ginger tea, warm water. What about if you have a good bowel movement or if you pass gas? Does that seem to make it better or not really?
Yeah, well, my stomach was kind of constipated after having the baby.
So you have a little bit of constipation. How often are you going right now?
Today I think I went twice.
They gave her
It's
enema the
diarrhea.
day before.
Okay. What if you're not taking anything? If you're not taking any enemas, how often is your body allowing you to go?
I usually poop once in the morning.
Once a day? Okay. Is it soft? Is it hard? Do you have to strain? Do you have to work?
It's usually soft,
Okay.
but it takes a while to come down.
Okay. So we're dealing with this pain that you mentioned, usually after eating. It started after your delivery back on February 5th. And then what about the nausea vomiting? Are they related to the pain or is it different?
Yeah, because I got tired of not eating, so I just went on and ate. And then shortly after, I got really nauseous, and then I threw it all up.
Okay, so the nausea vomiting occurs with the eating as well?
Yeah,
Do you feel like you get full quickly or not really?
yeah, pretty.
Okay, so you feel like you get full. Are you able to finish like a regular meal, or are you finding yourself like having trouble finishing?
Not since I had the baby.
Not able since the baby? Okay.
Well, even before I had the baby, I was eating very little.
And she's had gestational diabetes before,
Right.
but this is the first time that she's had to take insulin.
Okay. Interesting.
That matters.
Then tell me a little bit about the nausea vomiting. So, if you're not eating, do you get nausea?
Yeah, if I don't eat or drink, then I get nauseous. If I drink a little water, then I'll ease it some, but then I'll come back again.
Okay. So the nausea vomiting happens even if you don't eat? Does it get worse after you eat?
Yeah, if I eat something, then yes, I get worse.
The nausea.
Have
Okay.
you noticed
if
it
I
any
don't
better
eat,
if you eat different stuff?
Then I can wait a little while and sip some water, and then I'll go away, but then it'll come back shortly after.
How many episodes of the nausea vomiting do you get in a day, or how often do you get this?
A lot.
More than 5 times in a day? More than 10
Probably
times?
like 6. 7.
Okay. And then when you get the nausea vomiting, how long does it last?
Either until I throw up or get some medicine.
Okay. And then once you throw up, you get a little bit relief for a little while, and then it comes back? Okay.
Yeah.
And when you eat, it seems to make it worse. Okay.
Ah.
Have you lost any weight? Well, besides the
I
baby.
haven't checked.
Okay, no problem. No problem. How long has this been going on? This is the nausea, vomiting, pain, it was going on prior to the baby as well?
No. After I had the baby, then the pain, every time I ate, it was pain.
But the nausea, vomiting wasn't before?
Nausea and vomiting, no.
Because 7 years ago, when I went through your chart, you had a camera test done for the same thing.
Yeah.
So I'm just trying to figure out if this is something that you've had all along, or if this is something new and different.
It doesn't feel the same. Because I think that one was more anxiety and stress. And then this time I'm having medication for anxiety and stress since before I had the baby. Honestly, I think maybe I should just stop taking all the pills, and then maybe it'll reset my stomach or something. I don't know.
Are you taking pain pills?
No, I don't think so. Just labetalol and all these blood pressure pills and potassium, and swallowed the potassium, and then it came right out and you digest it all.
Yeah, that's not uncommon. That's a big horse pill, so it takes a long time for that to dissolve anyway.
I told them give me the smaller ones. I don't need to take the big one.
So the question is how to evaluate this. You've had a CAT scan done, they've done blood work. I think getting the x-ray is a good idea. I think the test you really need is an emptying study to see if things are, after you eat, if they're making their way through your intestines in a timely manner. Sometimes when you have diabetes or gestational diabetes, when you eat things, they don't empty out of your stomach quickly like they're supposed to. Usually when you eat, within 2 to 4 hours, within 4 hours for sure, most of it, 90% of it should be out of your stomach. But when you have things like diabetes and it affects the nerves in your stomach, the food builds up. So instead of emptying, you're just kind of holding more and more and more food to the point where you reach a limit and it starts coming back up because there's no more room for food to go down. And so that test is done using it's like a sandwich test where you eat a sandwich and then they check to see how much of it's left in your system in a couple of hours. But we don't do that in the hospital because it's done in a completely different area. I think that's probably the first test that I would consider doing for you once you're out of the hospital. The question is, what do we do here? Usually for these types of symptoms, going down with a camera is an idea. We can consider doing that since the last one you had was like over 7 years ago. I just want to explain what that will entail so you understand the risks and what you're signing up for before we just push a procedure on you. I'm happy to take a look. I can tell you that most of the time, over 70% of the time when it comes to pain like this, we're not going to find anything. We're not going to find an ulcer. We're not going to find cancer. We're not going to find gastritis. It looks fine. But I don't think it's the lining that's the problem for you. I don't think this is an ulcer. I think the nerves may be really sensitive and they might not be working right. So if you want, we can schedule you for a camera test. What that would involve is tomorrow, you'll have nothing to eat or drink today. After midnight, tomorrow we'll go down with the camera to take a look inside your stomach and your small intestine, and we may take some samples, some biopsies. You will get medicine to feel comfortable because we don't want you to be completely awake for this, but the medicines don't knock you out. You're still kind of half awake or in the twilight. So you will feel the camera go to the back of your throat. It's not comfortable. It's going to feel like you want to gag, but once we guide it down, we should be done in about 10 minutes. The other issue is, given your body habitus, when we give you these medicines to feel comfortable, it can slow down your breathing. So the last thing we want to do is do a test, which we don't expect to find anything, and then for something unforeseen to happen, like you stop breathing and then have to put a breathing tube in. Like that would be the worst case scenario. I don't think it's going to happen, but I need for you to hear this so we don't just jump and do a test. Like that would be silly, right? There are risks to the test like bleeding, infection, perforation, but they're usually all less than 1%. What I'm more worried about is how your body would react to the medications that make you comfortable. If that's something that you are willing to do for us or willing to do for yourself, then we can arrange it and we'll get it done tomorrow. If you want to pump the brakes and say that sounds more aggressive than I want to do right now, in the meantime we can start with the x-ray study and then we can potentially work on your symptoms, and then once you feel better, get you that gastric emptying test as an outpatient.
Oh, I still my eyes. I guess my vision is not that good. But it sounded like what you were saying about the nerve endings in her stomach being irritated. I think that sounds more like something that's happening here. What can you do for that?
So it's tricky because the first thing we do is we make sure she doesn't have an infection called H. pylori, which she doesn't. The second thing we usually try is an 8-week course of an antacid like Protonix. Not because you're describing heartburn, but because stomach acid is one of the biggest known irritants of the nerves. So we really work on getting that under control, because some of our patients, if you fix the acid issue, the pain goes away. And so I would have you take the medicine 30 minutes before breakfast on an empty stomach every single day, uninterrupted, for 8 weeks.
Wait, say that one more time, because I got caught up in the first.
She would need to take it every day for 2 months.
What is that, an antacid?
Antacid,
okay.
yes. If it doesn't make you better after 2 months, we stop. There's no reason to keep taking it. So you don't have an acid problem, right? We're just trying to get rid of the acid to see if it will stop irritating the nerves.
Okay.
Now, the second medication, if the antacid doesn't work, is a better medicine for pain sensitivity. It modulates the pain, but there are a lot more side effects. It potentially can interact with psych meds. So if you're on certain psych meds, we won't be able to give it to you. And it can slow down the emptying from your stomach. So I wouldn't start you on this until we do the gastric emptying study to show that your stomach is working properly, right? Because if this is an emptying issue, and I started this pain medicine or this pain modulating medicine, you might actually feel worse because your stomach is working even less than it currently is.
So is it possible to get her eating so she can get discharged and so she can make the outside appointment? And
is it possible to get her eating?
Yeah,
that's up to the team. It's up to how your body's feeling and whether or not we can slowly introduce more food. That's not something that...
Okay, she took one bite of that soup just before you came in. Are you in pain now, or is it okay?
Nauseous.
You feel nauseous? Is it possible maybe give her antacid and see if that
This
helps calm it down?
This antacid we can start for you. You might even be on it already. I'll have to double check the list. But you would take it every day first thing in the morning. It's not something that you take only when you have issues.
Oh, okay.
You know what I mean? It's
And
something that would be slowly building up into your system.
Is there something that she can take that's similar to that for like onset of like now?
Not really. If we gave you Tums or something that works quickly, I don't know if that necessarily will make it better, because you're not having heartburn issues. This is pain after you eat. You know what I mean? It's not the same thing.
I mean, how can one bite? Now she's sitting there. I can see the pain building, and then she'll be asking for.
Right. This is dyspepsia. I mean, this is irritation and pain after you eat. The food that you ate hasn't even made its way through your system yet. It's probably still in your stomach if you just took the bite. You know what I mean? So it's how your body's reacting to the food in your system.
Okay. Well, this is really good information. Thank you for this.
Sure.
It's been a really difficult month. Yeah.
Yep. So let's come up with a game plan. I can basically break it down into two. You have three options. Okay. One option is to say, I'm just gonna let it roll. I don't want to do anything invasive. I don't want you to put anything in me. I don't want to rock the boat. Let's just get the X-ray test first, and then we'll go from there. And I would say that sounds reasonable, right? You can say option number two, which is in between the first and the third. You could say, I don't really like the idea of doing something invasive at this time. I just had a baby, but I would like to do more than just the X-ray, in which case I can start you on the antacid, and we can just get that rolling for you every morning, see if it eventually will make you feel better a few weeks from now. Option number three is to say, I feel miserable, right? I'm here in the hospital. I want to get a look. I understand the risks. It's okay. Like, everything has risks that we do, but I want you to go down with the camera and make sure that since 2013, when I had my last one, there isn't anything in there I need to worry about. And I would say, no problem. We'll get it done tomorrow. But that's your decision. I think all three options, they have their benefits. They each have their own merits.
I just think we want to try to find a way to get her eating so she can get on with her life and do the outside stuff and studies to figure out why this is happening.
Right.
But it's
so what happens, let me put it this way, what happens if we do the camera test tomorrow and it looks normal? we're still where we are, right? It's still a functional issue. It's an issue at the level of the nerves, which we don't have any tests that can show us that. It's too small, right? There's no blood test that's going to say this is that. There's no imaging test that will show us that it's the nerves. But then it's about taking the medication, and the medication will take time. So even if you're here taking the medicine every morning, or if you're at home taking the medicine every morning, it doesn't matter. It's gonna take a while for it to get right.
But either way, she's got to eat, right?
So you think we should do the score?
I'm on the fence. If you've never had a scope before, I would say we should definitely look. But you had one in 2013.
No.
Kasia. Oh,
Oh.
are you Dr. Zhao?
No.
GI?
Yes.
Okay, thank you. You still nauseous?
Yeah.
You want your, I gave you your Zofran already.
What time?
About 12:30. Not about 6 o'clock.
Do you take any herbal supplements?
We do, but I mean, I love to do natural stuff, but
Does she take any currently?
no, not currently.
Not recently?
No.
Okay, good. Do you take any, do you drink alcohol? Do you take any edibles or marijuana, THC, that kind of stuff? Okay. I'm just trying to think of other things that potentially can bother the nausea center. The nausea center is located in the back of your brainstem. So there are all sorts of stuff that can make you nauseated and want to throw up. It's not just your gut. That's why this is so tricky, right? Everyone automatically thinks, let's do a camera test and we'll get an answer. That's not true. You can get nausea just from migraines, right? You can get nausea from taking you can get nausea from just smoking marijuana. So that's why it's tricky to expect for us to get a clean answer from taking a look with the camera. I think that it can provide reassurance that it's not a GI issue or a dangerous GI issue, but it's something that would need to be considered.
Well, if when she burps, do you get any relief? Is that a sign of something, or?
If you're belching and you feel relief, that's a sign that you may be having bloating and gas. I mean, it could be a combination of like what you're eating. It could be bacterial overgrowth. It could be celiac disease. It could be a whole bunch of things.
Well, she just ate one drop of anything, and there we are. Krisha, do you feel any relief when you're burping?
It's okay.
Are you having regular bowel movements now? Could you just be plugged up? Uh-huh.
I pooped a couple of times after that.
Did you feel better?
Well, God help us.
Okay. Is there anyone in the family with any GI issues? No. Okay. All right. What would you like to do? Would you like to do the camera, or would you like to hold off on that? You can change your mind. If you decide yes or no today, you can always change your mind tomorrow, but we need to make preparations if you do want to do that.
I don't think so, Krisha. That camera is just going to irritate more. It's just more invasive. Right now, you need to find a way to eat. That's what you need. That's what you need. Find a way to eat.
Okay. It's up to you. I think the camera would also give you peace of mind knowing there's not a blockage or something preventing food from going down.
What did the test do that she just did today? I was looking for the
Same
results.
type of thing, but it doesn't give you a look. It doesn't give you the look at the lining.
What does this one do? And were you able to get the results?
I haven't looked at it yet.
Oh, you haven't?
Nope.
Oh, okay. Can we see, where that's at first before we start going into another procedure?
Sure. It can take a little bit of time.
How long do you know? How long
It has to be. We have to go over it with a radiologist, so I'm not sure.
Okay. Okay.
Okay. So it sounds like we want to hold off on the camera. Is that what you want? Okay. We'll hold off on the camera. we'll follow up on the study, and then we'll reconvene tomorrow. We'll start you on the antacid, and we'll start with that.
How soon could she get that acid?
It should be given before breakfast in the morning,
Okay,
30 minutes before.
okay. And sometimes it take a while,
So it can take weeks for it to reach its full effect.
but
So
it might be some benefit in the morning.
I think so. I think I would give that a shot for 8 weeks before I stop.
Okay,
That'd be my recommend. If she saw me in clinic outside the hospital, that would be my recommendation.
okay. Is there a Tums or anything that we can try? She can try.
She can try.
now?
Sure,
Can you
but
order that for her? And see
just
if
don't-
that
I don't-
gets her
again,
relief?
I don't think that her Tums would be more effective if this was a straight up heartburn issue. If this was an acid overproduction issue. But that's I don't think that that's gonna. We can try. We can try.
It's really hard for me to watch her just keep getting weaker and weaker every day, and then she starts on the pain medicine, and then
What pain medicine? We're taking pain meds?
well, she was, and then they started giving her Ativan, and she said as long as it knocked her out, she didn't feel the pain.
So that is why, I mean, both those things, the Ativan and the pain medicine, can cause nausea.
Okay. Well, she was taking the pain meds and the Ativan. So is there a medicine that could knock her out that's not going to cause the nausea?
No, you can't knock her out and expect the gut not to also be knocked out.
Why? Okay. Was there a way to knock out the gut without knocking her out? I don't know. I'm just trying to.
Pain medicine, there are pain medicines that we could try. They're not as effective or as strong, but things like Tylenol, things like ibuprofen would be options that treat the pain but wouldn't cause your gut to not work as well. The ones that really work that make you feel better, the morphines, the Percocets, the Dilaudid, the Norcos, they directly slow down the gut. That's a complication from the meds. It makes you more constipated, it gives you nausea. It's a known issue, so that's a tricky situation here.
Okay. Krisha, were you taking a lot of pain medicine like the Tylenol or the Motrin over like the last year?
That's okay.
Did you
Tylenol
take
Motrin
that
shouldn't
off?
do it. It's the other ones.
No, I'm. You used to take Tylenol a lot, but not okay. But that should be okay. You
Yeah,
said?
Tylenol should be fine. Did you take a lot of Motrin or ibuprofen, Aleve, Bear? Okay. Okay, that should be fine. All right, that's okay. So we'll wait. We'll follow up on the X-ray first, and then we'll make sure that the antacid is written for the mornings. We'll try not to do pain medicines that will slow down your gut, and we'll see.
So you're saying they should stop the Advil now?
No, I think the Advil's fine.
Okay.
The Ativan.
Ativan, I'm sorry.
I'm not.
That's
as,
what I meant, the
I don't-
Ativan.
Yeah, I don't think that's a good idea.
So they should stop the Ativan. Is there something
I
else
would-
that she can use to help her be calmer? Because we're under a lot with the baby, and possibly having surgery on Monday and different stuff going on. So.
Sorry to hear that.
Yeah.
It's
Something else to help her sleep that would not cause the nausea.
that would not cause the nausea.
Yeah.
There are nausea medicines like the Zofran. Does that help? No.
No.
Yeah, we'll see. I'd have to look.
Okay. And it won't be tomorrow that we'll get the test back from the.
It may be later tonight.
Oh, okay.
It depends on how soon it can be processed, and then how
Okay.
soon we can get one of our radiologists to. The radiologists are the doctors that look at these pictures all day long.
Okay.
So we don't want your hospitalist to take a look and guess at what they're looking at.
Yeah.
And if I have any questions, I want to make sure I run it by them first before I come in and tell you what I think as well.
Okay. All right. Wow. Thank you.
You're welcome.
And my grandson would be like, "Can I get those shoes?" Because he just loves gold shoes. He literally loves them. Huh, Krisha? He wanted them for his birthday. He was like searching for gold shoes.
They were online and they were super cheap because nobody wanted them.
Oh, look.
So-
And you're Dr. Cool.
I don't know about that. She'll see. Let me take a listen to you. Let me wash my hands first, okay? Okay. So after talking to you, I think the game plan that would work the best for us will be give me some time to look over this X-ray that you just did. We'll make sure you get your acid medicine in the morning like you're supposed to, and then we'll touch base again. We'll come back again tomorrow to talk about what we have, and if the X-ray study looks perfectly fine, we can talk about whether or not you want to do one more test like the endoscopy to just reassure us that there isn't anything going on. If the X-ray study shows us that there's something going on, then we do the endoscopy to chase after it.
Could it be the amount of pills that I'm taking that's messing my stomach up?
But you was taking them before you had the pain,
I think
right?
so, because you're on a lot of things.
Yeah.
And on top of that, it's the diabetes that you had when you were pregnant, I think, is weighing in on this too. Because diabetes, what happens when your sugars are out of control, the nerves in your gut also get affected. They're innocent bystanders when you have sugar issues. And when they're not working very well, again, we talked about things don't empty. So when you're eating, your stomach, which is this reservoir that holds what you eat, usually when you eat, it fills up, but you don't even notice the sink is draining, right? So it empties on its own. 2 to 4 hours after you eat, the food that you just consumed is gone. But when it's not working well from diabetes, it's just slowly pulling up. And you won't feel anything until it gets so full that it starts coming back up. And at that point, that's when you start feeling super sick, and then you don't want to eat, you feel full because your stomach's already full. I wonder if that's playing a role in this. But the best way to look for an emptying problem is with that sandwich test, which we can't do here. We have to wait till you're feeling better to do it in another building
So you
outside.
can actually eat a sandwich. huh?
Exactly. So that is something we'll keep in the back pocket that I think would be helpful at some point if you don't continue to get better. The next question is when and if we do a camera test.
So we just stop pills for a couple of days, see what happens.
It depends on which pills you're talking about. Let me just go over this one more time. Sorry about that.
It's like, no more pills. I'm just so sick and tired of pills.
Some pills are good for you, and some pills are good for you, but they cause problems. It's never like a clean situation. But let me see what I can find. Okay. So currently here in the hospital, you're taking an inhaler, presumably for your asthma. You're on a medicine to help prevent clots. You're on the labetalol. You are taking labetalol for your blood pressure. You're taking montelukast or Singulair for your asthma, the morphine. So that's one thing that is, morphine's so tricky. It's because it helps. It works quickly. You feel better, but it will make you nauseated. And the morphine slows down the emptying of your gut.
Ooh.
So not only your stomach, but also constipation. So that's why it's such a tricky medicine. You take it and you're like, oh, this feels so good, but then it's like actually sometimes can make the problem worse. So I would do my best to hold off on it. If you're in excruciating pain, of course, you do what you need to do. But because of the symptoms that you're describing, I would do my best to try to hold off on that.
Could you see if you could find, or would you recommend any other pain meds that wouldn't do that, or that would be better?
She has Tylenol written. It's just not as strong. I don't think you'll get that immediate relief. So you're taking Zoloft. That medication is a good psych med. It's actually it's a solid SSRI. But the problem with the medicine that modulates the pain, it doesn't work when you take Zoloft. There's an interaction that can be dangerous. So if we ever need to go down that route in the future, we would need to talk to your psychiatrist and talk about whether or not it's worth it to come off of the Zoloft, or whether we can even try that medication.
I'm thinking too, if you stop the Zoloft, you can do that once you're able to eat again, you know?
But I wouldn't do that without first talking to the
I mean, she just started it like last
psychiatrist.
week, but yeah,
last week.
yeah, I think so. Like not that long record.
And then the Ativan. I would do my best to try to come off of the Ativan.
If you could recommend a difference or something,
Okay.
that would be good.
I'll talk to your team.
Okay.
Okay. All right. We may be able to try a medicine called hyoscine. It's also known as Levsin. The nice thing about this medication is you only need to take it when you need it for pain, and it works differently than the morphine, but it should work fairly quickly. It is an antispasmodic, so when you put it under your tongue, it dissolves, much like the Zofran, and it basically causes your abdominal intestines to ease up when they're feeling like they're tightening up on you. Okay. I don't know to what degree that's going to make you feel better. Hopefully you'll feel much better, but it's something different that hasn't been tried that may allow you to come off of the morphine.
And
And
what
the
kind
Ativan.
of side effects with that?
Usually the side effects are uncommon, but you can get a little bit of like GI issues. Like it can make you a little nauseated as well.
Oh, there we go, that nausea thing again.
Right. It's just there's nothing
Nausea
that's
is
very
easy
clean.
to
I
get,
think
huh?
I think Tylenol would be the best thing for pain that doesn't cause nausea. So would ibuprofen, but they're not as like sort of like strong as the morphine is, obviously. Okay. Let me take a listen to you if you don't mind. How did you deliver your baby? Got it. Okay. Let me have you lift up your shirt for me, just so I can see your belly. Thank you. Where's the pain when you get it? Are you able to get up into a chair in the daytime? Okay. Is that okay when I press right now? It hurts when I press? Up here? Okay. Thank you. Let's take a look at your feet. Okay. In the daytime, we can get. I would like for you to try to get into a chair, and then try to get a little bit more active, because that can also help with the constipation. And if you're constipated and you're not moving your bowels like you normally do, that can also contribute to